What a stroke looks like the day before it hits. Know this to protect yourself. Something is about to happen inside someone's brain today. Not tomorrow. Today. And in the hours before it happens, that person's body will almost certainly send signals. Small ones, easy to dismiss, the kind of thing you put down to tiredness, to stress, to getting older. And most of the time, those signals will be ignored. Not because the person is careless, but because nobody ever told them what to look for. I want to change that today. Hi, I am Dr. James Whitfield. I am an emergency medicine physician, and I have spent just over a decade working in the ER. In that time, I have treated more than 40,000 patients. And one of the things I see consistently, is people arriving after a stroke who, when I ask them, describe warning signs that were there the day before, sometimes 2 or 3 days before. Signs they noticed but did not connect. Signs that, if they had acted on, could have completely changed what happened next. My mission with this channel is to stop you from ever being that person, to give you the knowledge that the healthcare system rarely has time to give you before a crisis lands. In this video, I am going to walk you through the warning signs that can appear in the hours and days before a major stroke. I am going to explain the actual mechanism, what is genuinely happening inside the brain and the blood vessels, so that these signs make real sense to you rather than just being a list to memorize. And at the end, I am going to give you a clear action framework, so you know exactly what to do if you or someone near you experiences any of these. This is one of those videos where knowing the information could genuinely save a life, so let us get into it. Before we do, a quick ask. Only about a quarter of the people who watch these videos regularly have actually subscribed. If you want more content like this, content that goes past the surface and actually explains the science, then please hit subscribe. It helps this channel reach more people who need it. I promise to keep making these as useful as I possibly can. And if you get to the end and did not learn anything new, you are welcome to unsubscribe. No hard feelings at all. Now, let us start with the most important concept in this entire video, because without it, the rest will not fully make sense. Most people think of a stroke as a sudden event, something that just happens out of nowhere, like a light switching off, and sometimes it does arrive that way. But what the research is telling us, increasingly and very clearly, is that for a large proportion of strokes, particularly the most common type, the ischemic stroke, where a clot blocks blood flow to part of the brain, the conditions that cause that stroke have been building for hours, sometimes days beforehand, and in many of those cases, the brain gives warning signals. These are called transient ischemic attacks, or TIAs, but they also come in subtler, harder-to-label forms that do not fit the classic TIA picture. They are the body's way of saying that something is unstable upstream, and they deserve to be taken with complete seriousness. Let me explain the mechanism first, because it matters. Most ischemic strokes are caused by either a clot that forms in a narrowed artery in the brain, or a clot that forms elsewhere, often in the heart or in a large artery in the neck, and then travels up and lodges in a smaller brain vessel. In both cases, the moments before a full blockage are often unstable. Plaques in artery walls can crack slightly. Small clots can form and temporarily block blood flow before dissolving again. Blood flow to a region of the brain can drop intermittently, and when brain tissue is getting intermittent, reduced blood flow, it tells you, just not always in the way you expect. Number 1, a brief episode of weakness or numbness on one side of the body. This is the classic TIA presentation, and yet it is still missed constantly by patients and occasionally even by healthcare providers because it resolves. The person notices that one arm feels heavy or weak, or that one side of their face feels strange, or that their hand is not gripping the way it normally does, and then, within minutes to an hour, it is gone, completely gone. And because it is gone, people talk themselves out of acting on it. It resolved. I must have just slept on it funny. I must have been sitting awkwardly. That reasoning is extraordinarily dangerous. What we know is that a TIA, that brief episode of neurological symptoms caused by a temporary reduction in blood flow, is one of the strongest predictors of a full stroke we have. There was a study published in The Lancet that analyzed over 10,000 patients who presented with TIAs and found that the risk of a major stroke in the following 48 hours was between 10 and 15%. 10 to 15% in 2 days. That is not a minor warning, that is a fire alarm. The weakness or numbness resolves because the temporary clot dissolved, but the conditions that created that clot almost certainly have not changed. If anything, that first clot is a sign that the system is unstable. Please treat it that way. Number 2, sudden vision changes. This one is particularly important and particularly underreported. Vision changes before a stroke can take a few different forms. Some people describe a sudden blurring or loss of vision in one eye, sometimes described as a gray or dark curtain coming across the visual field, which then resolves within minutes. This is called amaurosis fugax, and it happens when a tiny clot temporarily blocks blood flow to the retina, the light-sensitive layer at the back of your eye. The retinal artery is a branch of the same internal carotid artery that supplies a significant portion of your brain. So when you are getting temporary blockages in the retinal artery, your carotid artery system is telling you something important about what is going on upstream. Other people describe double vision, or loss of part of their visual field, not in one eye but in both, towards one side. That pattern, called a hemianopia, happens when blood flow is disrupted to the visual processing area at the back of the brain. Both presentations deserve urgent evaluation. Any sudden change in vision, even if it resolves, is not something to sleep on and call your primary care doctor about tomorrow. It needs to be evaluated today. Number 3, sudden severe headache, different from any headache before. I want to be precise here because a lot of people get headaches, and I am not trying to make every headache a source of panic. What I am describing is specific. It is the headache that patients describe as the worst headache of their life, or simply as completely unlike any headache they have ever had. It may come on very suddenly, sometimes described as a thunderclap, reaching peak intensity within seconds or a minute or two. This pattern is a red flag for a hemorrhagic stroke or for a subarachnoid hemorrhage, which is bleeding around the surface of the brain, often from a ruptured aneurysm, which is a small balloon-like weakness in an artery wall. Now, most severe headaches are not strokes. Migraines, tension headaches, and other benign causes are far more common, but the pattern matters enormously here. Sudden onset, reaching peak intensity rapidly, described as completely different in quality from previous headaches. These features together should prompt immediate emergency evaluation. In the ER, we take this presentation very seriously because missing it carries an enormous penalty. Number 4, sudden difficulty speaking or understanding speech. This is one that can be subtle and deeply unsettling for the person experiencing it. It might show up as a sudden difficulty finding the right word, where a word that should be completely automatic is suddenly just not there. Or as producing words that come out slightly wrong or jumbled, or as a strange difficulty understanding what someone else is saying, where the words are heard, but they do not quite compute. These are signs of disrupted blood flow to the language centers of the brain, which in most people sit in the left hemisphere. The thing is, people often try to hide this. They feel embarrassed. They think they are just tired or distracted. I have sat with patients in the ER who described being in a conversation the previous evening where they noticed their words were coming out wrong, and they changed the subject and moved on because they did not want to alarm anyone. Please do not do that. Any sudden change in your ability to speak, to find words, or to process language is a neurological symptom, and it needs to be evaluated urgently. Number 5, sudden unexplained dizziness, loss of balance, or coordination problems. This one is tricky because dizziness is an extremely common symptom with a very long list of benign causes: dehydration, Inner ear issues, low blood pressure when you stand up, low blood sugar. Most dizziness is not a stroke. But there is a pattern of dizziness that should concern you, and it is this: sudden onset dizziness that is accompanied by any other neurological symptom. Dizziness plus sudden difficulty walking. Dizziness plus double vision. Dizziness plus one-sided weakness. That combination is a different animal entirely. It points towards the posterior circulation of the brain, the vessels supplying the brain stem and cerebellum, which is the area at the back of your brain that controls balance and coordination. Strokes in this territory can be particularly dangerous because the brainstem controls your most basic vital functions. If dizziness comes on suddenly and is accompanied by any other symptom on this list, that combination needs immediate emergency evaluation. Number 6. Sudden confusion or a change in mental state. This one is especially important for family members and partners to know about, because the person experiencing it often cannot accurately assess what is happening to them. A sudden and uncharacteristic change in mental sharpness, appearing confused about where they are, or the time, or what they were doing, behaving in a way that is out of character, seeming unusually drowsy or flat. These can all be signs that blood flow to the brain has been disrupted. In older adults particularly, a sudden unexplained change in mental state is a presentation we take very seriously in the ER, because it can be the presenting sign of a stroke that is not yet showing classic localizing symptoms. If someone who is normally sharp and oriented suddenly seems confused or unlike themselves with no obvious explanation, that is worth an urgent call to emergency services. Number 7. High blood pressure readings that are significantly elevated. Now this one sits slightly differently to the others on the list because it is not a symptom as such. It is a measurable number. But I am including it because it is one of the most important pre-stroke warning signals we know about, and because home blood pressure monitors are widely available and relatively inexpensive. A blood pressure reading that is acutely and significantly elevated, particularly above 180 over 110, so 180 over 110 millimeters of mercury, represents what we call a hypertensive urgency or emergency, depending on context. This level of blood pressure can directly rupture small vessels in the brain. It can stress arterial walls to the point of catastrophic failure, and it can be completely asymptomatic. You can feel fine and have a blood pressure reading that represents a medical emergency. If you have a home blood pressure cuff and you get a reading significantly above your normal, particularly above 180 over 110, that is not a wait-and-see situation. Now here is the practical framework. The FAST acronym is well known: face drooping, arm weakness, speech difficulty, time to call 911. It is a good acronym and it saves lives. But as you have just heard, it does not cover everything. So here is an expanded version I want you to remember. Think of it as be fast, balance, suddenly off, eyes, sudden vision, change, face, drooping or uneven, arms, one side weak or numb, speech, slurred or wrong words, time, the most critical variable of all. Time matters more in stroke care than in almost any other emergency medicine setting. We have a treatment for ischemic stroke called thrombolysis, which uses a clot-busting medication to dissolve the blockage. But it has a tight time window. The sooner it is given, the better the outcome. We also have mechanical thrombectomy, where we physically retrieve the clot using a catheter, and the window for that is also time-limited. The phrase we use in stroke medicine is "time is brain," and it is not hyperbole. Every minute a stroke goes untreated, roughly 1.9 million neurons die. That is not a rounding figure. That is from direct measurement in the research literature. So here is your action framework. If you or someone near you experiences any of the symptoms I have described today, even if it has already resolved, you call 911. You do not call your primary care doctor and wait for an appointment. You do not drive yourself to an urgent care clinic. You call 911 and you say the words, "I think this might be a stroke." Those words will trigger a specific response pathway that is designed to get you evaluated and treated as fast as possible. If it turns out to be nothing, you will have lost a few hours of your day. If it turns out to be something, those hours could be the difference between full recovery and permanent disability. And here is the bigger picture I want to leave you with. Most of the risk factors for stroke, high blood pressure, smoking, atrial fibrillation, diabetes, high cholesterol, physical inactivity, obesity, are things that have been silently building for years before any stroke occurs. The ER is brilliant at stabilizing people after a stroke hits. I see that every single day. But I would far rather have you never need us for this. Know the warning signs. Know that resolution does not mean resolution of risk. And if your body sends you a signal, take it seriously, because it is not being dramatic. It is asking for help. The studies and research papers referenced in this video are linked in the description below. If this was useful to you, please give it a like. It genuinely helps more people find it. And if you are not subscribed yet, please do subscribe. Take care. I will see you in the next one.